Good morning all. Welcome to today's meeting of the Dundee Integration Joint Board. Arlene?
Yeah, thanks very much, Councillor Lynn. Unfortunately, Arlene's off at present. It'll be myself this morning to take you through the agenda.
I beg your pardon, Willie. Sorry, that's my first error of the day and I hope the last.
No, not at all. Not at all. So firstly, I'd just like to remind everyone that these proceedings are being recorded, the recording of which will be placed on the websites of the Health and Social Care Partnership and the Council for public viewing. I will now take a roll call of the voting members for the minute, and I would ask if members would confirm they're present when I call their name. Councillor Lynn.
Present.
And I've received apologies from Bob Benson at this moment in time. He may be joining the meeting a bit later. Colleen Carlton.
Present.
Thank you. David Cheap.
Present.
Thank you. Councillor Siobhan Tolland. Your marker is absent at this moment in time. Councillor McHugh.
Present.
Okay, thank you. That concludes the roll call. I don't have any apologies for absence at this moment in time. It then takes you on to item 2, declarations of interest. As whether or not any of the members have any declarations of interest to the content of the agenda as it stands.
No.
Okay, there being no declarations, then it takes you on to the minute of the previous meeting of the Integration Joint Board held on 16th of April, which is submitted for approval. There's also the accompanying action tracker, which is submitted for noting and updating accordingly.
Just give us 1 second. I'm using a digital copy. I'm trying to locate this. Sorry. Yeah, so I'll go through the minutes page by page as I normally do, and if there are any inaccuracies that anyone notices, maybe they could let us know. So page 1 of the minutes. Page 2. Page 3. Page 4. See no hands, so these are accepted as an accurate record of our last meeting. Thank you.
Okay, thank you very much, Chair. You then have the accompanying action tracker, which is submitted for noting.
Any comments on the action tracker? Dorothy.
Thanks, Ken. Yes, the first one, which relates to hybrid meetings. And this was discussed in December 2024. And I'm wondering if there's going to be any resolution of this discussion for hybrid meetings. It's now due to be discussed in June 2025, which is now, but it's not on the agenda.
The most recent update I've had from Roger Many on that, Dorothy, is that his intention at that time, Roger's here actually, I don't know if he would like to update us, was to visit some facilities at NHS Tayside to assess their suitability along with those from Dundee City Council. I wonder if you'd be able to give us an update on that, Roger.
Thanks very much, Councillor. I'll be very glad to do that. Just to confirm that in my capacity as Head of Democratic and Legal Services at Dundee City Council, I'm clearly aware of the facilities that can be provided by Dundee City Council. I'm not familiar with those that could be provided by NHS Tayside, and I'm awaiting an invitation from the Board Secretary to visit Ninewells or any other facilities that may be appropriate to review the facilities there, and then I'll report back to the Board with recommendations.
Okay. I hope that can be as soon as possible. I was really hoping that our next meeting in August could be in a hybrid format with members who are able to be present, being present, and those who are unable to do so joining online. Dorothy, is that you happy with that update?
Yes, I'll wait for an update from Roger. Thanks, Ken.
Thank you.
Ken, can I come in?
Yes, certainly, David.
Yeah, it's just for Roger's benefit, for everybody's benefit. I think most people know that there should be no reason why the NHS Tayside boardroom can't be used for this, because we use it for hybrid meetings as it is just now for all sorts of meetings at NHS Tayside board and committee meetings. And alternatively, there's another offer. I would have thought that Angus Council have in their chamber hold their hybrid meetings, and it works perfectly well in both these locations. So these two are, I would have thought, obvious locations that could be used.
I'm not sure we'd want to move up to Angus, to be honest, although I appreciate that. Certainly the Dundee City Council chamber is suitable for hybrid meetings, as are some of the committee rooms, as indeed is our group meeting room. This has taken a lot longer to resolve than I would ever have hoped, and I hope it can be in time for our next meeting in August. Dave?
Yeah, no, thanks, and we'll I'll kind of explore the options with Roger as well, to get it and report back on that. I think one of the challenges is around, certainly for some of the Dundee City Council rooms, is the size of the room. If everybody was to kind of turn up face to face and kind of having a facility that kind of operates effectively on that. So, but we'll scope out the options and look and see what's the kind of the most preferential option for the IJB. Thanks.
Well, going back what's now a number of years, we used to meet in one of the committee rooms. I assume that they're all set up for hybrid meetings, as is the chamber, as I said, as is our group meeting room. So anyway, I won't go on. I think everyone knows that I've been pushing for this, as indeed as the vice chair for some time. We'll just wait for Roger's update. I don't see any other hands on the action tracker.
Yeah, I have something, Ken.
Oh, sorry, Dorothy.
It's okay.
Number 8. Number 8.
Number 8 on the second page. A request from Raymond from the trade union to be represented on the SPAG for consideration, and again that's scheduled to come back at this meeting.
Sure.
In fact, it says it was to be considered on the 22nd of May by the SPAG.
Yeah. Catherine?
Yeah, apologies, Dorothy. We should have updated that before the final papers came out. I think the draft was done before the SPAG met, and then the final one should have been updated. So yeah, that was considered, and unsurprisingly, there was no concern about that at all. So we will add Raymond, or a nomination from Raymond, to the membership list, and make sure that they've got the dates for the future meetings.
Thank you.
That's sorted then. That's good. Take that off for the next meeting. And there are no other hands now. So next item, please.
Yeah, thanks very much, Chair, and I can confirm that Councillor Toland has joined the meeting. Item 4 then is Appointments Committee minute of meeting of 30th of May, which is submitted for noting.
Yeah, as I think everyone will know now, Dave Berry, who's been acting up for some time as the Chief Officer, was appointed as our new Chief Officer following the process which is described in the minutes of the Appointments Committee on the 30th of May. Really pleased to have Dave on board permanently, and look forward to continuing with the good working relationship that I've always had with you, Dave, and the good working relationship I think you have with every member of the IJB. So congratulations and onwards and upwards.
Thank you. Yeah.
If I could just intervene now, we were going to take the sorry, 1 second. Yeah, the Fairness Leadership Panel we're going to take that as the first item following Performance and Audit Committee's Chair's Assurance Report. Given that Bob's going to be joining us a wee bit later, I think, could we just move on to this item now, please, Willie, which is item number, is it 10 on the agenda?
Yeah, thanks very much, Convener. Yeah, item 10 is the Fairness Leadership Panel report. It's at page 115 of your agendas. And you're asked to agree the proposals.
So yeah, I'd like to welcome 5 members of I believe there's 5 members coming along. I'm not sure if they're all here. I have 5 names, certainly. I see that we have Roxanne Campbell here. Danielle Donaldson's just popped up there. Ethel Davidson, I believe, is coming as well. Daniel Burns, and Peter Allen, I think. Are you all here? If you're not all here, I'm sure you'll have arranged who's going to make the presentation about your April 2025 report, which we all look forward to hearing. So I'll just ask you to kick off if that's okay.
Thanks very much, Ken. Yes, I have Ethel Donaldson, Tammy Brown, and Daniel Burns here with me. So we're all in one place so that we can all have a decent internet connection and we're not burning through data or anything like that. So I will apologize. It won't maybe be the smoothest because we're going to have to take turns in the hot seat. But if you can just bear with us, we'll share with you some highlights from our report over the last 18 months. So I'm going to start by turning you over to Ethel, and she'll start us off.
Okay. Right. Oh, James, I've got to read all this. I'm not very good at remembering things. Right, so, excellent. Right. Hi, everyone. I'm Ethel. Thank you for the opportunity to share with you some of the recommendations the Fairness Leadership Panel has spent over the last 18 months working on. The panel is made up of people with lived experience of poverty and organisational leaders working across the city. Together we work to ensure that those who are often unheard have a voice. Members bring their experience and knowledge to our discussions to seek solutions together. We meet 5 times a year, plus host an annual conference, and subgroups meet to look at specific issues or themes that we often invite others to advise and update and inform us on in the area of influence. In 2023, panel members visited local community projects, asked questions about the impact of the cost of living crisis. We reviewed the feedback and then asked ourselves, how much influence does the panel have over these issues? And how much of the top priority is this issue to the Dundonians? These helped us choose 3 areas of focus. 1, mental health and isolation. 2, fair housing and pressures on the third sector, and projects tracking poverty. The working groups looked further into these issues. We spent time listening to people in local community, frontline staff and managers from relevant services. Today, we would like to focus on mental health and isolation recommendations. And a few recommendations from the other group that we feel are relevant to the board. First, I'd like to pass you over to Tammy that will share a couple of our Fairness House recommendations. Thank you.
Good morning. Hi, I'm Tammy. I was part of the Fair Housing subgroup. Housing has a huge impact on people's mental health and well-being. We spoke with people attending 5 different community projects and 2 different third sector services that support people with housing issues. A couple of our housing recommendations are, 2 of the biggest issues were issues around damp and mould, and inconsistent support from housing agencies when looking for help. A couple of our housing recommendations are to develop a Dundee standard of training for frontline staff for the phone and in person, for social housing providers, taking on board some of the principles of trauma-informed practice, mental health approaches, and diversity/inclusion. Develop a Dundee standard of damp/condensation guidance for social housing providers, ensuring a consistent approach to quality advice and information to all tenants. We know that housing isn't directly within your remit, but one of the Health and Social Care Partnership ambitions is to help to reduce inequalities in health and wellbeing that exist between different groups of people. Unhealthy and unsafe housing is a root cause of inequality. Things like damp and mould impact the long-term physical and mental health of people, and inconsistent or confusing support can jeopardise people's well-being. Please see our report to find out more of the issues and solutions that we uncovered. Thanks for listening. I'm going to hand you over to Daniel to talk about the third sector. Thank you.
Hello. Hi, I'm Daniel, and I was a part of the third sector subgroup that looked at the concerns of the projects that support the people facing poverty. These projects play a massive role in caring for the mental health and the well-being of our communities and helping people get the financial support that they need or are entitled to. People feel less isolated, safer, better supported, and less stigmatised in these spaces. But many of these third sector projects are struggling like never before. One of the managers says to us, more and more of us is being asked of us, but we have fewer and fewer resources to fill these needs. Our people are burning out. One of the third sector recommendations is to ensure that the local community projects that are providing direct response to the people in financial crisis have the practical and well-being support of their volunteers The wellbeing support of the volunteers need to be able to continue to provide crucial local services. We know that the Health and Social Care Partnership plays a pivotal role supporting the third sector, so this situation won't come as a shock to you. However, we urge you to prioritise this, because without these projects, who knows how many people will fall through the cracks. Please see our full report to find out more of the issues and solutions we uncovered. Thanks for your time, and I'm now going to pass you back to Danielle, who's going to share with you our work for the mental health and isolation subgroup.
Hello again. I'm Danielle. I worked with the mental health and isolation subgroup. When we visited projects in 2023, projects shared with us that there's been a rise of people who have never really struggled with their mental health before and don't have the coping strategies needed to move forward. They also said that since COVID, it's been hard to get people to reconnect or engage because they feel anxious and they end up excluding themselves. Projects highlighted that one of the things that keeps people isolated and struggling with their mental health is not knowing what help is available to them. So rather than accessing early interventions, they end up at crisis point. To help us understand more about these concerns, we spoke to the senior service manager of Hope Point and the manager of the local distress brief intervention team to get an idea of what it's been like for services. We visited projects in 3 of the most deprived areas of Dundee who are trying to support people with their well-being. We met with clinicians from the Dundee Health and Social Care Partnership to discuss how mental health support can be made more accessible in Dundee. And here are some of the things that we learned from those conversations. We learned that there's too many barriers that prevent people from connecting to services, and people are struggling to get the help that they need when they need it because of overly complex systems. Community projects specifically asked for better support and training on where to signpost people who are struggling with their mental health and well-being. We learned that the community is asking for more face-to-face support They pointed out that if everything is online or over the phone, it often increases feelings of isolation. Online can be a starting point, but as much as possible, online information should signpost people to opportunities where in-person connections can be made and support can be given. Local people we spoke to want the city to prioritize community spaces because they provide vital support. Someone compared it to how a city would never close an A&E because it provides vital support, life-saving services. And they said that these community spaces are the community's A&E, and they shouldn't be closed. I'm now going to pass it over to Roxanne, who's going to share with you what we think would help.
Hello, I'm Roxanne, and I was also part of the Mental Health and Isolation subgroup. The group have 3 recommendations that we believe will make things better for our communities. And the first recommendation is that we recommend that all mental health and well-being developments in the city are meaningfully co-created with people with lived experience of poverty and mental health challenges to ensure that people know about developments, that they are accessible, and that they are meeting the needs of the community. During our research, we learned a lot about some of the great work that the Health and Social Care Partnership are already doing, but we also learned that the community doesn't always know about these things and that they don't always feel that they have a voice in what's happening. We know that you're trying to change this, and we'd encourage you to continue to try new things, even if it's harder, and even if it takes longer, and even if things don't work right away. So that was our first recommendation. Our second recommendation is that third sector and community projects are directly informed of and supported to use information about services and resources that can help people address poor mental health and its causes. This will help projects signpost people in need to relevant support. Community groups and projects are where local people go to feel seen and heard. Within these groups, there is so much wisdom and empathy in how to support people. Empowering them further with signposting training would boost people's confidence in how to best support people. So that was our second recommendation. Our third and final recommendation is the city prioritises and protects local community projects that provide early interventions to improve people's well-being, mitigating the negative impacts of the cost of living crisis and isolation. As Danielle outlined, somebody highlighted to us that the community spaces are the community's accident and emergency department. These places and spaces are where people go to feel safe, to feel supported, and as much as possible, these projects need to be protected. Thank you, and I'm now going to hand you over to Daniel, who will conclude for us.
Hi, again. Since our recommendations, we attended the event in the Mental Health and Wellbeing Strategic Planning and Commissioning Group, hosted as a part of their review of Mental Health and Wellbeing Strategic Plan for our city. We thought this was a great event with a good balance of working professionals and professionals by experience. We have also been involved in the co-production of a mental health and wellbeing website and are eager to see how this develops. Asking the community what they need isn't always straightforward and is not always easy, but if we persevere, we discover solutions that are dignified and meaningful. We would encourage you as the leaders in our city with vast networks and influence to help implement the recommendations of the Fairness Leadership Panel. Our work represents what the community is asking for to help reduce poverty and inequality in our city. Thank you for your time and your attention. We'll take a bow, but it's hard to do on the laptop.
Thanks very much for your presentation, everyone. And we've got roughly 10 minutes or longer if need be for any questions that might arise. I really enjoyed listening to your presentation this morning, and I think it's essential that we work closely together now and in the future. That's not just empty words. The recommendations for this report indeed say that very thing, that we instruct the Chief Officer to ensure that the implementation of your recommendations is supported by the Health and Social Care Partnership, and also asks the Chief Officer to ensure that the Strategic Planning Advisory Group considers your recommendations as part of our work to review the strategic commissioning framework. And I think we have some forum in listening to what the members of the Fairness Leadership panel say. And I've said this a number of times. Your predecessor, the Fairness Commission, came along to one of our meetings, must have been before COVID, 5 or 6 years ago, certainly, to make a similar presentation as you have today. And they made it very clear during the presentation that the one thing that would make a difference in terms of improving the people of Dundee's mental health would be a 24-hour open access centre for people who are have mental health issues, or really anyone who is in distress. And, you know, as a direct result of that, we, you know, several years later, Hope Point, which has been referenced in your report, opened and has now been open for a couple of years. So we do listen, and it's certainly my intention as chair to ensure that the recommendations of the report, which ask us to take forward your recommendations and to continue working closely with you to make sure that does happen. And I will do, and I'm sure that applies to all the other members of the IJB as well. So thanks very much for your presentation. I'll now take questions. Colleen Carleton.
Hello. Sorry, I dropped out the meeting for a wee while there. For some reason, my laptop went dodgy. So I heard Ethel, Tammy and Daniel, and then when I came back, it was Daniel again. So I apologise, I've missed somebody in the middle there. But yeah, just to say what a fantastic initiative this is. I loved reading your report. This is something that I have a real personal interest in, is addressing inequalities. So I am on the Dundee IJB. I am also a board member for NHS side. So I'd just like to offer my support to you guys. And if it's possible at any point, I would love to come along to a meeting or your annual conference or whatever it is. So if one of the dates, if I could attend, that would just be fantastic. I was also picking up in the paper, so one of the things that we're all aware of is how difficult it is for apologies if this has already been said when I wasn't here as well, for third sector to actually future plan or do anything when they only get funding for a year. It's just about impossible. So I was at the NHS Scotland event in Glasgow a couple of weeks ago, and this question was asked of Caroline Lamb and Neil Gray, and they had said that this is something they're very aware of, and they've acknowledged that given how difficult it is to future plan, it's actually more cost effective if they give a longer term funding rather than a year. So they have committed to doing that and said that that is their plan. So I'm hoping to hold them to that if that's the case, and see how well that goes through, because I think that would make a huge change to third sector companies, because there's very little you can do if you don't know if you're getting your money in 12 months time again. So I'm just hoping that's something I'm keeping an eye on, in the hope that they keep their promises there. But yeah, just really an acknowledgement of how fantastic all the work is that you're doing, and just an offer of support. And I would love to come along to something at some point if I can.
Thank you, Colleen. Dorothy.
I don't really have a question, it's more of a comment. This is an excellent report. We read so many, you know, I do certainly as an IJB member and as a local councillor, and this report is well written in plain English, very easy to understand, very user friendly, and I'm so impressed with your recommendations, especially considering you reached them with the help of local communities and local people, and that is so important. I wholly endorse your recommendations, and I will support them in my role as a local councillor and here on the IJB. Thank you very much for this work. Wonderful.
Thank you for that. David Cheap is up next.
Yes, morning. It's like, endorse what Dorothy's just said. She's really took the words out of my mouth there. The report was a very user-friendly report to read, and because of that, it was very easy to understand and see where the need has really come from. And as Dorothy said, you've clearly engaged with people who are directly affected in this, and that's really important. But I really applaud you for actually having reached out and gone in to investigate lots of areas yourself of where potential hope point would be to visit, and really it's really the best, probably the best place I think to assist. And the recommendations in the report are very clear, and we should be supporting them as much as we can entirely. Thanks very much.
Siobhan Told.
Hi, thank you. Just, I've put in the chat that obviously I was involved in part of this research and was part of the third sector support working group that was set up. But I do have a question around this. We spoke a little bit about this at the meeting on Wednesday, but if there was one thing that you would maybe want the IJB or Dundee more generally to do, to think about preventative measures in terms of health, what do you think that might be? I'm aware that Dave's quite keen on that as our new CEO, and also John Swinney's, our First Minister's statement on Monday talked about preventative health as well. So just wondered if there was any thoughts around that.
Go for it. So sorry, I'm here. A lot of what the third sector subgroup was finding is that third sector projects, as the guys have said, are pivotal in supporting very vulnerable groups in our city. But part of the issue that we heard is they're not sure where to signpost people. They're only really aware of Hope Point and Karst View. So if there's any intermediate or
because the two places are very crisis oriented, aren't they? So it's kind of in that support, that middle ground, I guess, where it's not quite to a crisis point, but
they need help.
Yeah.
So some sort of signposting training, again, because we learned a lot about some of the great stuff the Health and Social Care Partnership is involved in and supporting and trying to initiate. So going out to those projects and just sitting with some of the lead volunteers or some of the organizers of those projects and just informing them of all the stuff that's happening and how they can signpost people just would, I think, go a really long way in helping those projects feel more confident in where to get people the right support.
The groups and organisations are struggling at the moment to keep their head above water, closing some of them. So we're losing a lot of them. So we need to try and keep them going. Maybe funding or whatever, I don't know, but keep them going because they're vital to people, me included. So we need to keep them going.
Thank you. Can I bring in Dave Berry next, please?
Yeah, thanks, Ken, and thanks to all the presenters today. That's actually the second time I've heard the presentation, but a completely different one from the first time, because you really kind of focused on the issues that kind of the IJB has kind of oversight as well. So I'd just like to kind of thank you for that. And I think there's a kind of a few things for me, sort of kind of themes that have come through that. So if I kind of link it back with the IJB's priorities, there's a couple of things that you've kind of talked about today, which are things we need to kind of focus on, because you talked about there about the access to services. So that kind of open door and access is one of our priorities, and making sure that that's easier to access services. So that's so the kind of learning from today is one of that. One of those, the whole issue about planning together, so working with you and working with communities to kind of plan our services is kind of really key as well. So that's kind of come through as a kind of strong theme there for me, and obviously kind of tackling the health and inequalities within the city as well. So there's some kind of really kind of big kind of hooks there for us as an IJB to kind of take back and consider in terms of how we start to kind of plan and deliver our services. As well, I think another key thing, and Siobhan alluded to it as well, was around the kind of launching the population health framework by Scottish Government. So that gives us a real opportunity to kind of put the work that you guys have started and kind of identified at the kind of heart of everything we do. So I think it's very timely that you're here today on the back of that launch yesterday, and that'll be one of our kind of key priorities and drivers as we move forward. So I'd just like to thank you again for that. I think that was kind of really excellent. Thanks.
Peter Allen. Hi, Peter.
Hi, thanks very much, Ken. I'm one of the guys that facilitates the panel, and I'm just going to put a slightly firmer edge on what they were saying. What we've been doing as presentations on the recommendations. The recommendations have been adopted in full by the partnership and are going to be incorporated into the city's fairness plan and the action plan. So we'll be having to measure progress on this, but we haven't quite identified who's going to be responsible for taking forward the various recommendations. But undoubtedly, there's going to be a role for the IJB and some of your colleagues. So I think the panel will be, well, so in the first instance, I'll be trying to make sure that our actions are robust and understandable, and that they genuinely reflect the recommendations as they were made. But secondly, I think the panel were also hoping to be able to get a sense from the various groups that they're going to do presentations to at some point in the future, what difference did it make? Is there any sign that you guys were listening and were able to take action and feedback to them? So at some point over the next few months, you're probably going to get a letter from the panel saying, thanks for giving us the chance to do a presentation, but it'd be great to know what actually came of it from your perspective. So I hope that's helpful. Thank you.
That's helpful. Thanks very much for that, Peter. I see no other hands, and yes, I do. I see Sheila McMahon.
Yeah, I was just going to come in quickly on that last point. The panel's already written to the chairs of the Mental Health and Wellbeing Strategic Planning and Commissioning Group and the Mental Health and Primary Care Strategic Planning Group, so Arlene Mitchell and Linda Graham, to request a discussion with them to agree to look at explore and agree how those forums can help implement the recommendations, particularly around awareness of services. They heard really clearly that local organisations, projects didn't know where to signpost people, as we've heard today. There are a couple of developments in mental health that may support that. Some of you might be familiar with the fact that the NHS Tayside website now has specific mental health pages on that has a directory of organisations, as well as information about the mental health multidisciplinary teams that sit around general practice. There's also been a co-production of a mental health leaflet on the back of the Engage Dundee survey, which was targeted particularly at people who were digitally excluded. That was supported by NHS Tayside Charitable Trust and was well distributed over Christmas. There's a new website that's in the pipeline, will sit independently, so it'll have a bit more kind of functionality and user usability around design and what can be included on those pages, that is being co-produced at the minute by local people, with local people and mental health service providers and others. And as I think Daniel said during the presentation, the review of the mental health strategic plan was kicked off by an event in the steeple, which was well attended by a wide range of individuals. A stakeholder group has now been formed to work through that review that's been supported through DVVA. So their support is commissioned through Health and Social Care. So there are already things in the pipeline, but I completely take the point that there will be other things that have to happen too, that this group in particular may need to look at how it can help push those things forward as well.
Thanks very much. Someone, I think, was it you or was it Peter before you used the two words lip service, and I think it's certainly the case that we are not just going to pay lip service and thank you for coming along and making a lovely presentation and then forget all about it, because it's very clear, as I said in the recommendations for this report, that we are with you on this. We support your recommendations and we intend to work with you and other groups to take the recommendations forward. I think we'll just formally agree that actually before I say farewell to you. Can we agree those recommendations from 2.1 to 2.3? Yep.
Absolutely.
We have unanimity on that. So thank you again for coming along this morning. And yep. I wasn't sure if someone else was wanting to come in there, but no, just the mic leaking. So yeah, thanks very much for coming along. I look forward to hearing more about what the Parents Leadership Panel is doing in the next year. And as I say, yeah, we're behind you all the way. So thanks very much.
Thank you. Thanks very much. Thanks for your time.
Thank you. Bye.
Bye.
Well, that was a good start to the meeting. Let's hope the rest of the meeting goes just as well. Time will tell. Yeah, so I noticed that Bob's joined the meeting now, so I think we could move on to is it item 4, Willie?
Yeah, item 5. Thanks,
item 5,
Chair. Yeah, Performance and Audit Committee Chair's Assurance Report is before you, and as you mentioned, yeah, Bob Benson's in the meeting.
Yeah, so everyone had a chance to have a look at this. And are there any questions for Bob resulting from the minutes of the last Performance and Audit Committee meeting? No, so that's agreed. Thank you.
Okay, thanks, Chair. Takes you on to item 6, Dundee Integration Joint Board Annual Internal Audit Report, which is before you, and you're asked to agree the recommendations.
Okay. I'll introduce this one and then I'll pass it on to Jocelyn. Just to check that this paper actually came out as supplementary agenda, so I'm hoping everybody managed to have a look at it. So apologies for that coming out as a late paper, just due to demand and workload and quite everybody when the original papers were being issued. So yeah, but I'm pleased to share with the annual internal audit report, which also incorporates the internal control evaluation, which is in Appendix 1. So I'm going to pass over to Jocelyn and Lyle in a second, but just to take you through a few key points from my perspective. The annual report sets out the Chief Internal Auditor's findings of the IJB's governance framework and overall internal control systems. And the internal control evaluation in Appendix 1 has noted 13 findings, including 1 significant, 10 moderate and 2 merits attention. And the management response and actions are detailed within the report there as well. We'll also incorporate these into our overall governance action plan. The work undertaken has also reviewed the self-assessment, our self-assessment annual governance statement, which is also part of the annual accounts, and areas of continuous improvement. Pleased to note that the assessment concludes IJB has adequate and effective governance, risk management and internal control arrangements in place, and reasonable assurance can be placed on the internal control evaluation as well. I'd just like to thank Jocelyn Lyle and her team from FTF Internal Audit Services for all their work to produce this report, and their ongoing support as we continue to work through and address the areas of improvement that have been highlighted. Jocelyn, Do you want to take us to anything else?
Yep, thank you, Christine. I think you've probably covered the main points. As you said, this is my opinion as Chief Internal Auditor on Dundee City IJB's internal controls, governance and risk management arrangements for the 24-25 financial year. Just for the purpose of the minute, if I may, I will confirm my opinion. So as Christine said, that's that the IJB has adequate and effective governance, risk management and internal control arrangements in place. I can also confirm that the 24-25 internal audit plan was delivered in line with public sector internal audit standards. I haven't advised management of any concerns around consistency of the draft governance statement with information that we're aware of from our work. I haven't advised of any concerns around the description of the processes adopted in reviewing the effectiveness of the system of internal control and how those are reflected. I have no concerns around the format and content of the draft governance statement in relation to relevant guidance, and no concerns around disclosure of all relevant issues. So that's the kind of the official opinion part of it. Just a wee bit of background. Just to explain that the overall internal audit opinion for the year is based on 5 separate elements. So firstly, and really importantly, are the outputs of the IJB internal audit plan for the year, and those are Appendix 1. So that annual plan is complete, apart from the audit of the lead partner services, which is ongoing and will be presented to the Performance and Audit Committee in September. Secondly, another key source of assurance is the internal audit work carried out in each of the partner organisations, where those reports are relevant for the IJB assurances. So the main findings from those reports are presented to the Performance and Audit Committee in our regular progress reports, and they're listed for you just to pull them all together at Appendix 2. Thirdly, as Christine said, the output of the 24-25 internal control evaluation, or the ICE report, which is at Appendix 3. And it's really just due to the timing of the issue of the ICE and the time taken to clear that report that we haven't had an opportunity to present it to the pack. I mean, that's standard every year. So it's appended to this annual report. But together, the ICE and the annual report bring together all the assurance and the overall systems of internal control. And fourthly, we've, as Christine again said, we've reviewed progress with delivery of previous internal audit and other governance improvement action points. And that's really through the governance action plan that again is considered at each meeting of the pack. Finally, we followed up agreed actions from previous ICE and annual reports. So as Christine said, we have 13 findings. I won't go through all of them. I just wanted to point out the one significant finding, which centred on review of budgets with adverse variances. And we've said it would be useful to have a look at those variances and the initial planning assumptions to see if they can be attributed to those assumptions, and really just looking backwards, making sure that lessons have been learned from previous years and are built into the financial planning process. So we've agreed an action for that one. That's all I wanted to highlight. I would like, if I may, just take the opportunity to thank Dave and Christine and the wider team for their support and assistance in clearing the ICE and annual reports, but also for their support during the year in assisting us in delivering the internal audit plan. But I'm happy to take any questions on the report. Thank you.
I'm on mute, sorry. Yeah, Dorothy, you have a question.
Yes, thank you. In the annual report, section 1, there's a comment about the budget proposals for the consultation totaled 7.8 million, although spending had to be reduced by 19.7. I did raise this during the budget proposal development sessions, and I wonder how the IJB, if you have any suggestions as to how the IJB can take this issue forward. The comment is that operational efficiencies and non-recurring initiatives should not comprise the bulk of a budgetary gap plan. And I did have concerns about this specifically the fact that we consulted on £7.8 million of cuts, although we were actually cutting 19.7 million. And I think there's an issue of transparency there.
I'm just sorry, can you direct me to the paragraph number, please, Dorothy? Is that? Oh, I see it now. Okay. Yep. So I think it's really just, yeah, I'm not sure I have any actual advice on it. And probably Christine would be better placed to answer that one. But yeah, I think we're just saying really that, you know, we need to look for recurring savings, and these non-recurring savings are not going to make, you know, to get the IJB where it needs to be. But I see Dave's got his hand up, so I'm hoping he's got something to add.
Dave, would you like to come in?
No, thanks, and thanks, Dorothy, for that kind of particularly. I know that's one we have to kind of discuss previously as well around it. And I mean, I do agree in terms of the balance should be kind of the other way, because it should be around the kind of service change and transformation. I think what we accepted in terms of the budget for 25-26 was the significance of the challenge was much greater than we'd ever anticipated. And kind of transformation and kind of change was on its own was never going to be able to kind of deliver all the savings that were required to balance the budget. So in terms of kind of going forward, what we're kind of looking to do in terms of a kind of senior management team is to kind of start that process much earlier to identify the transformation projects and service redesign and changes, i.e. the things that would be kind of truly around IJB policy decisions that would need to be made to kind of shift that balance around. I would just point out though that there is it's not unusual for organisations to have that kind of difference in terms of operational efficiencies and ones that are actually more around kind of strategic decision making. And even reflecting on Dundee City Council's budget proposals, there was a kind of similar approach in terms of operational efficiencies that were not asked by to be voted on by councillors that kind of form part of the budget process, and then a residual kind of decision making there as well. But absolutely accept the point that you've kind of raised, Dorothy, that certainly in terms of transparency, that kind of balance in any other year would be kind of certainly flipped around the other way. And there is something that, again, picking up the specific kind of audit point around the sort of non-recurring and kind of operational side not being the kind of bulk of the savings proposals. Non-recurring just gives us a kind of a recurring problem, if you like, because it just rolls forward to the next year. But again, that's something we're picking up as a management team.
Yeah, certainly something to work towards for next year's budget. Not just stopgaps, but yeah. Yeah, so thanks very much for talking us through that, Jocelyn. I see no other hands, so can we agree the recommendations, please, at 2.1 and 2.3? Yeah, I see no dissent. Thanks very much.
Thank you.
Thanks, Chair. With that item being agreed, item 7 then is unaudited annual accounts and your scheme recommendations.
Yeah, back to me for this one. The next few reports all kind of overlap each other in different ways as well. So there may well be parts that are linked to other reports, and indeed within the unaudited annual accounts there is reference back to the annual governance statement, which we've already looked at as part of the internal audit process as well. So I'm pleased to present the 24-25 unaudited annual accounts to the IJB, along with the funding variance statement and annual governance statement, which are all part of the appendices of the report. The funding variation statement in Appendix 1 reconciles the opening budget offer from the partner bodies in 24-25 to the actual funding that was provided for the year, which incorporates sort of in-year adjustments and additional funding that we'd received. The annual governance statement is Appendix 2, and we've also just covered in the internal audit is the self-assessment statement on the governance arrangements and the effectiveness of internal controls. And Appendix 3 is the unaudited annual accounts, which follows statutory accounting principles and treatment, and details the IJB's received delegated income from partner bodies, which totaled 357.361 million to provide adult community health and social care services to the population of Dundee. Our net spend during 24-25 was 363.439 million, which resulted in an overspend of 6.078 million, at least in terms of the statutory accounting presentation of it, with 4 million of this previously identified in the financial plan as an expected overspend or gap during 24-25. The overspend that we have seen has been fully covered from IJB reserves. However, it does mean that our IJB reserves have reduced from 17.8 million down to 11.7 million. And we should continue to recognise that the majority of these reserves are continuing to be held for ring-fenced or specific purposes, and therefore are not available for general contingency purposes. The accounts incorporates a management commentary detailing information relating to population demographics, IJB memberships, operating delivery model, and operational achievements and challenges during the year. The IJB are also specifically asked to note some additional funding that we received from NHS Tayside right at the end of the financial year 24-25, totalling 2.959 million, as detailed, a bit more detail in section 3.3 of the covering paper, which was to support whole system pressures and sustainability. And the IJB are asked to approve this funding we placed into an earmarked reserve in the annual accounts to be utilised during 25-26 as per recommendation 2.4. The IJB are also asked to note and approve the documents in the 3 appendices, the recommendation to approve the ring-fencing of additional sustainability funding, as I just mentioned, and instruct the unaudited accounts to be passed to Audit Scotland to commence the audit process. I'd also just like to thank my wider finance team within the Health and Social Care Partnership, and also colleagues from the wider Health and Social Care Partnership as well, and colleagues from NHS Tayside and Council finance teams for all their support to complete, to actually produce the figures and complete the accounts, alongside all the commentary sections as well from operational colleagues. Happy to pick up any questions that anybody might have.
Yeah, thanks very much for that, Christine. I've already mentioned the fact that Dave was acting up for some time, and the same thing applies to you. You've been acting up as Chief Finance Officer for some time, so thanks for all the work that you've done in bringing this together. Are there any questions? Dorothy.
Just on that comment that you've just made, Ken, in the report, it talks about these acting up posts, and I wondered what happens next to posts affected by the appointment of Dave as the Chief Officer.
I'm not sure that's not relevant to this particular. I think off table we could probably get something out to IJB members about the process now that we've appointed a permanent Chief Officer, if that would be all right, Dorothy, rather than bringing it into this particular item.
Yeah, okay. It is in the report in Appendix 1, discussed. Well, I have another question, if I may, and it relates to the improvement table at the end of that appendix, and there's one item. Review and further develop the strategic plan performance measures, and this was scheduled to be reported back in December 2024. It's now been put off until December 2025. That's a year's delay, and it's badged as amber in accordance with the assessment of a minor delay. I think this is not a minor delay, a full year. That should be badged as red, not on track.
I think that's a fair point, actually, Dorothy.
Yeah. No,
any comments on that?
I think, yeah. It probably does reflect sort of we have had areas of continuous improvement through the time, but this one has not met its previous expected target. And we do have strategic planning review sort of scheduled for this coming year. So we will pick that one up there. But yeah, no, fair point. And that's I can change that before we publish the accounts and pass that on to the auditor.
So yeah, so if that is changed then to red before it's submitted to the external auditors, that would be great, and have your commitment on that. So can we agree the recommendations then, in particular from 2.1 to 2.5, in particular 2.2, which approves the draft integration joint board annual corporate governance statement as outlined in Appendix 2, and at 2.5, which instructs the Chief Finance Officer to submit the unaudited accounts to the IJB's external auditors by the 30th of June. Is that agreed? Yes, thank you.
Okay, thanks, Chair. That takes you on to item 8, financial monitoring position as at March 2025.
Okay, back to me again. Okay, so obviously throughout the year, we produced the financial monitoring reports to yourselves in terms of the operational financial position, and for transparency and comparison purposes, the year-end financial monitoring report is also presented in its normal format, in the format that you're used to seeing, to detail the operational position throughout the year in comparison to all the previous year's figures. The operational overspend figure in the report does vary slightly from the annual accounts presentation, due to the sort of presentation of reserves movements and the slightly different treatment of some of that position. The operational overspend for 24-25 is 7.216 million, which is actually an improvement of 676,000 from the projected figures that we were looking at the end of February's position, which were presented to the IJB in the April meeting. It should also be recognised that this is a quite considerable improvement from the peak projected position shared with the IJB in October meeting, where we were looking at an projected overspend for the year of 9.005 million. And at that point is when we implemented the financial recovery action to address that significant unplanned overspend in 24-25. The actions and controls that we've taken during the second half of 24-25 have improved the financial position. And it's also hoped then that the legacy impact of these changes will continue to have an improved financial position and the spend patterns and the trends going forward. Just to highlight one of the points of this, though, this improvement has occurred during the second half of the financial year, during the winter period, at a time that we've traditionally experienced a higher level of demand and pressures. And also we've continued to see continued strong performance in delayed discharges and meeting care at home packages and maintaining low levels of unmet need. So in other words, that reduction in spend does not appear to have materially impacted on our key performance pressures or key performance areas during the second half of the financial year as well. So that in itself is a strong performance and that's a noteworthy point for it. Areas of key variance are noted in section 4.3. Key areas of operational overspend continue to be care at home services, learning disability services and community nursing, all mainly as a result of higher levels of demand and increasing complexity among the individuals that these services support. We also do continue, sadly, to be experiencing challenges in recruitment and retention, which on one hand does give us a financial benefit due to long-term vacancies where these posts have remained unfilled, but on the other hand also result in cost pressures due to having to backfill some of these essential clinical and patient-facing roles with supplementary staffing, and that premium cost of that, where possible, managers are obviously trying to mitigate or minimise the spend implications. But we do still have quite a significant reliance on supplementary staffing with premium cost implications. So the IJB are asked just to note the the year-end operational financial position for 25 as detailed in this report. Happy to take any questions again.
Thanks very much, Christine. I've glad to hear the improving, slightly improving position. I've certainly been keeping a close eye on the delayed discharge figures, which continue to be amongst the best in Scotland. Very few people having to remain in hospital when they don't need to be or don't want to be there. So that's really encouraging news, despite the financial pressures that we've been experiencing. Are there any questions on this report? No. So we've now, yeah, sorry, I have to agree the recommendations, don't know they? Yeah, the recommendations are this report is just for noting. So thanks for that. We've now been an hour and 5 minutes in, so we could maybe take like a 7-minute break and come back at 12 minutes past, please. Thanks very much. Hi, thanks everyone. Welcome back after that short break. Just trying to find the right page here for our next item. Welly, over to you, please.
Yes, thanks very much, Chair. Takes you on to item 9, Dundee Integration Joint Board Budget Update. You're asked to give the recommendations.
Thank you. So this paper here is bringing an update to the budget proposals that we signed off and approved in March. It is as a result of the improvement that we've seen in the financial position for 24-25, and therefore the improved reserve position that we now have, but also following the receipt of the additional funding from NH&S Tayside for whole system pressures and sustainability. So we now, due to the improved financial position in 24-25, we actually still now have a balance of just over £1 million, 1,023,000 in general reserves in the IJB's accounts, plus that additional whole system funding of 2.959 million, which is detailed in 4.3. As a result, I'm now proposing that we reduce the majority of the 1.5 operational efficiency target that we were going to be applying to all services on a non-recurring basis in 25-26, reducing this down to 0.25%, and actually utilising a further portion of the general reserves balance to commit that to close the 25-26 financial gap. These are detailed in section 4.4 and further expanded in the appendices 1, 2 and 3, which are the highlighted figures are showing the amended figures in terms of our balanced budget proposal for 25-26. Also incorporated into this report is an update on the externally commissioned services, where we agreed to reduce spend by £1 million from the overall budget of 51 million, overall spend of £51 million. Section 4.5 and Appendix 4 provides an update on this recommendation to withdraw from a further commission service. And an updated IIA is detailed as attached, detailing the impact of this proposal. It's fully acknowledged that the IJB continues to be faced with an extremely challenging financial position for 25-26, but it is hoped that this slight change to the structure of the balanced budget proposals helps to ease the pressure slightly on operational delivery during the coming year. And further to the comments that were made earlier, particularly around the split between recurring and non-recurring savings and that longer term planning. Just to highlight, as Dave's already mentioned, as a management team, we've already commenced our conversations to start the budget planning process for 26-27 and future years as well. So that's started as early as possible this year to keep things moving as quickly as possible and actually have longer term plans put in place. So the IJB are asked to note and approve the changes to the 25-26 budget setting report. Again, happy to pick up any questions or comments from anybody on this.
Yeah, thanks for that, Christine. Pleased to see that improved financial position and that we have been able to make that reduction to the operational efficiency target away down to 0.25 from 1.5, which doesn't, of course, mean that we shouldn't continue to seek operational efficiencies where appropriate. And pleased also to
Yeah.
see that we have a modest amount in reserve, a very modest amount for a rainy day. So let's hope that we don't have too many rainy days, because that's a really small amount in reserve, Dorothy.
It's a very small amount compared to the overall position that we're in, but it gives us something at least.
Yeah, sure. Yeah, Dorothy.
Any improvement is welcomed, Christine. Any improvement at all. I wanted to draw attention to the proposal to decommission the services provided by Hillcrest Futures. And I'm not sure if the alternative proposals included in the report will fully replace the service that Hillcrest has been providing. I'm not sure how employability services and welfare rights will address social isolation and homelessness in particular. Now, I understand how necessary it is to cut our costs, but I just want IJB members to note there are 13 negative impacts in the integrated impact assessment if we agree to decommission the service. So I just want you to bear that in mind. 13 negative impacts will be the result of decommissioning these services.
Yep, duly noted with regret. Are there any other questions? See any hands? Flynn, would you like to come in, please?
Thank you, Chair. And again, a helpful report, and obviously good news with the improved financial situation. Conscious though, and Christine said there's a cluster of linked reports, and just referring back as well to the internal audit report, will we get updates going forward on the transformation programme impact and the difference that's making to the budgetary situation as well? I assume we will, but just to confirm and double check.
Yeah. Well, there was quite a few transformation commitments made during 24-25. It's probably taken until towards the end of the financial year before some people have actually been in post. So the impact probably at the stage of these reports in terms of sort of the end of financial year and moving into the new financial year have been limited at that stage. But yes, we will incorporate that into both the sort of overarching financial report, but also ask the leads on the transformation plans programmes to bring back updating reports in due course. Some of them are sort of 12-month commitments, some of them are 18-month commitments, and then we've still got a small element of transformation funding within our reserves for look at further developments that come forward from our services as well. So yeah.
Thank you. Dave.
Yeah, just in addition to what Christine's described there, we've got a number of reviews that we'd kind of agreed at the IJB in March that are due to come back for an update report, and I think they'll be due in August. So that's kind of part of the overall sort of transformation in terms of some of the service reviews and service changes. So we'll get that update to you shortly.
Thanks very much. Can we therefore agree the recommendation from 2.1 to 2.5 with particular reference to 2.3, which approves the application of these additional reserves, and at 2.4 approves further changes to updated external commissioning plans as detailed in 4.5? I see no dissent. Thanks for that.
Thank you.
Thanks, Chair. And we've covered item 10. That then takes you on to item 11, which is the Health and Care Staffing Scotland Statutory Annual Report, and you're asked to agree the proposals.
Yep. Sorry, this is item
11.
Item 11.
Beg your pardon. Yes, Catherine, I believe, is going to speak to this. Yeah, hi, Catherine.
Yeah. Thank you. I'll just do some introductory bits about it, and Glenn might want to comment in his capacity as Chief Social Work Officer as well, given the scope of the report. So this is IJB's first annual report. which is required under the Health and Care Staffing Scotland Act 2019, but which wasn't actually implemented until 2024, because I appreciate that it seems a bit strange we're doing a first annual report more than 5 years after the original legislation was passed. That focus of the annual report is around safer staffing principles and considerations, but only in relation to the activity of the IJB where it's planning or securing services from another person through a contract or another type of agreement. So this only relates to the IJB's commissioning of external services. It doesn't relate to safer staffing issues for the internal workforce at this stage. So just to be clear about that. Obviously, the IJB doesn't procure services, it cannot do that. The Dundee City Council does that on your behalf. So again, the scope of this report from an integration joint board point of view is really just about that planning element. And that's part of the reason why we're proposing that the IJB and Dundee City Council produce and publish a joint annual report because of some of those complexities around governance, and to try to pull all of that together into a single report that would allow a member of the public, for example, to understand all of that activity for all social care and social work functions, rather than having one report for the IJB and something separate for the council, which would probably feel quite disjointed, both for yourselves and for other interested parties. So that's why we're kind of making that recommendation. I think the other thing to say is that there has been, well, this is the first year of reporting and there's been quite limited guidance. So we have tried really hard to think about what would be useful for people to understand around this kind of activity, and members will note that we obviously are reflecting back that a lot of our activity around the commissioning of services and safer staffing requirements is not new, that this has been best practice in social care procurement and commissioning for a large number of years, and at section 4.5 of the report we reference some of the other legislation that has been in place before the safer staffing requirements came in, that really drove us to look at these areas and the principles that overlap around safer staffing requirements as well. So I appreciate for many people who've maybe been involved around social care services for a long time, some of what we describe in the report are things that you'll be well aware of and that we've been doing for many years and reporting to you under other guises. But the report is not unhelpful in terms of bringing that together and making that really clear for people, I think. So that's a bit around the context. Glenn, I don't know if you want to make any comments from a professional point of view, given that it's a social care focused report.
Yep, Glenn.
Well, thanks, Chair. Thanks, Catherine. Only really to emphasise that it does formalise existing arrangements. Obviously, it requires us to report now on commissioned services that have been commissioned in the last 12 months, but arrangements are already in place in terms of contract monitoring, scrutiny via inspection, case-by-case discussion in relation to any particular concerns or challenges. So it helpfully formalises that, and I wouldn't add anything else other than to say that separate arrangements are in place in relation to core services. So council-employed social work, social care staff, separate arrangements are in place in relation to their own workload and support. I'll stop there and perhaps open up for questions.
Yeah. Are there any questions on this report? I don't think there are. Can we therefore agree recommendations from 2.1 to 2.4, noting in particular those 2.2 and 2.3 which ask us to approve something? At 2.2, approve the proposal that we produce and publish a joint annual report. At 2.3, approve the content of the draft annual report. I see no dissent. Thank you.
Thanks very much, Chair. It takes you on to item 12, Category 1 Responder, Annual Report. You're asked to give the recommendations.
Thanks, Chair. That's myself that'll be speaking.
Yeah, Angie, I was just checking who was speaking on that. Yeah, thanks.
So this is an annual update report. It's noting that the strategic risk has been reduced and archived, and I'll highlight just a few things as to what's impacted that decision. So there was a concurrent live exercise carried out to test the Dundee City Council's response to multiple incidents. It involved a live air exercise at Dundee Airport and the Council's Incident Management Centre at West District Housing Office, which was also dealing at the same time with a tabletop exercise for a fire in a block of flats. And that was quite a successful exercise, quite a lot of learning out of that, which is being built into our plans. Work's ongoing to build the national power outage into the business continuity plans, but this is complex and requires Scottish Government input to inform the communication strategies before we can really map out how we will manage this locally. The workshop that was carried out was really, really positive in terms of engagement and staff starting to generate ideas, and that's been taken out, and we will have further events. We now have additional managers volunteering to support the rest centres in the out of hours period, and there's plans in progress to carry out tabletop training for all managers at integrated manager level and above, with service manager and above completing the full rest centre manager training, which gives us a much more robust process for responding for any incidents that goes beyond a sort of 12-hour period. There's been 3 incidents where the BCPs have been required in the last year. The first was Storm Eowyn, where all the BCPs maintained services successfully, but it allowed us to test our response via community alarm for the power outages, because the community alarm triggers an automatic response if the power goes out in any individual homes, which allowed us to then go in and do welfare checks and make sure people were all right. I think there was only 3 responses triggered in Dundee, and we were quite fortunate. The PARD database is a vulnerable persons database that will be coming online. It's been tested in Angus at the moment, but that will also bring in other data other than just community alarm, so that again will be much more robust going forward. The second was the tenements flats fire. The rest centre was placed on standby, but that was quickly stood down as all tenants managed to find alternative accommodation themselves and with support from housing. And the third was South Grange, where Dundee and Angus worked very successfully in partnership to support the care home residents. There's a debrief has literally just come out in the last 2 days, so we're going to use that debrief to update the care home evacuation plan, which is a Tayside-wide document. So quite a lot of work there. There's a lot more in the report, which I won't go into, but happy to answer any questions.
Thanks very much for that, Andy. Interesting to see that there's an app being developed where people have volunteered to help out. In case of emergency, can be contacted quickly, and that there's been an increase in the number of volunteers too, which is encouraging. Are there any questions on this report? Don't see any. So can we agree the recommendations, in particular that the Chief Officer will bring back a further report in 1 year's time? Thank you.
Yeah, thanks, Chair. Takes you on to item 13, annual complaints and feedback report, and I believe that Catherine Sharp's speaking to this item.
Yeah.
Thank you, Willie. So this is the annual overview report around complaints and feedback received through the partnership. And as usual, there's a bit of context about our slightly complicated complaints processes because we have a number of them that we manage. But overall, you'll be able to see that there's been a trend of reducing number of complaints actually since 21-22, and that continued over the last year. So in total, there were 179 complaints received in 24-25, which in the context of the number of service users and interventions that we provide to members of the public is obviously quite a small number. Again, in that period, there were only 4 complaints that were escalated to the SPSO, 2 from a health perspective and 2 from a social care, social work perspective, and none of those were pursued or investigated further by them at that point. So we are talking about a small proportion within the overall context of the activity of the partnership. You'll see, in common with previous years, from a health perspective, the majority of complaints continue to be in relation to mental health services, whilst in social care there's a bit more variation, and although they tend to focus on areas around failure to meet our service standards or to provide a service, there's more variety across a wider range of social care and social work services. Around 50% of our complaints are upheld, although this is slightly higher percentage when we get to escalated stage 2 complaints, but overall across all stages, around 50% are either upheld or partially upheld, so some element of the complaint is kind of acknowledged and recognised as needing improvement. Again, members of the PAC who get annual quarterly reports around the complaints and feedback, we were speaking about this at the last PAC meeting. There continues to be challenges in terms of meeting our timescales across all types and stages of complaints for response. But in general, this really reflects the kind of nature and complexity of the kinds of complaints that we receive. The need to investigate those thoroughly and sensitively, involve family members, service users, etc. So in the majority of cases, our timescales issues are in relation to that. There is very close monitoring of complaint processes and timescales, and mental health in particular, kind of regular meetings to make sure that we're progressing and responding as quickly as we possibly can, and also keeping complainants informed if there is a delay, which is part of our process and procedures. And just finally to highlight the work around care opinion, and I think complaints are a really important aspect of what we do, but I think care opinion gives us the opportunity to have a bit more scope and a more accessible way for us to gather, collate and report feedback that's both about where services could be improved, but also where the impact of services has been positive. We receive lots of compliments, although it's hard for us at the moment to collate those because they tend to go into individual teams. Some teams pass them on, and there's an example in the report, but care opinions should allow us to look at how we can build on and learn from some of our good practice and how the positive impact, as well as looking at where we need to improve as well. So I'll leave it there, and if there's any questions, happy to try to answer those.
Any questions? I'm certainly pleased to see the number of complaints received reduced year on year from 2021-22, but as you said, they are a very small proportion of complaints in terms of the services that we provide to such a large number of people. Dorothy.
Thank you, and thank you, Catherine. I've got a couple of questions here. One relates to the tables. Each of the tables mentions missing data. What is this, and what is the extent of it?
Sorry, I was switched between two screens there. So are you referring to the ones at section 7?
Yeah, 7.1.
Yeah.
Yeah.
Actually, it starts on 6.1. It's the first one.
Please. Yeah. So not all, I understand I don't put this report together, Dorothy. So it's one of my colleagues who spends a lot of time doing this. So there might be details I need to check. But my understanding is that the numbers don't always add up to 100% because not all complaints have been resolved. Some are withdrawn or transferred to another department, etc. So sometimes the number we receive and the number that we complete through the process varies, and that's the difference between them. But I'll double check that understanding with Cheryl, who's steeped in the detail of this, and let you know if there's anything further to add to that would be useful for you to be aware of.
I understand how the numbers don't add up, Catherine, but it references in each of the tables missing data. That's really the crux of my question. We don't need. I don't need an explanation here, but if I could, if you could look into that. The other thing I wanted to ask about was at 8.4, Dundee Health and Social Care Partnership complaints coordinators meet with the NHS Tayside Patient Experience Team. Is there an equivalent team for social work?
No, we don't have a kind of equivalent team that do that. With the complaints kind of follow up and kind of feedback is distributed between a number of people. So there's a couple of people in their strategic services who have a kind of focus within their remit around what you might term service user experience, I suppose. And then that is supported by a very large number of colleagues across operational services in terms of how that works in practice as well. So we don't have an equivalent infrastructure, although we do still have obviously a clear focus on that, and hoping to build that up further with the care opinion kind of coming into play this year as well.
Yeah, okay. Thanks, Catherine.
Thanks for that. So, yeah, can we agree to recommend? Well, this report is for noting. That's a recommendation. So, thanks for that. Next item, please. I think it's the final substantive item.
Yeah, thanks, Chair. Item 14 then is the Dundee Health and Social Care Partnership Workforce Plan. And again, Catherine Sharp is speaking to this item.
Thanks, Will. Take us through this in Jenny's absence, who Jenny chairs our workforce planning group. So we're presenting today for approval a fully updated version of the Health and Social Care Partnerships Workforce Plan, which we've been working over the first half of this year to really quite substantively review and update. The main drivers, as it says in the report, for that have been around the requirement for a further national workforce planning submission, but also to respond to the recommendations that were made by our internal audit colleagues at the beginning of this year in terms of improvements they felt that could be made around the kind of infrastructure and the contents of the plan. As the report points out, at section 4.4, workforce planning for integrated health and social care services is a really complex task, but it's also extremely important that we kind of progress this as far as possible and get it right in terms of the contribution our workforce make to our overall kind of strategic priorities and outcomes. But it is important that IJB understand the challenges that sit round about this, and that those aren't just experienced by us in Dundee, that is a national challenge around workforce planning for health and social care partnerships. And some of that relates to the fact that a lot of the levers sit out with the delegated authority of the IJB as well, and the challenges that adds into the picture. Section 4.5 and 4.6 talk a bit more about the process that we've gone through. I'll not go into that in particular detail, but I think that some of the things that we've really tried to move on and strengthen in this version of the plan are a bit of a shift, and we hope we've managed to move on significantly from describing the workforce to really much more about analysis of what challenges that presents. So we've streamlined a lot of the data and information and tried to really focus on some of the key messages about what the workforce challenges are. There's more information in the plan that's been informed by workforce engagement, and also trying to do as best as we can within the limitations that we face, anticipating some of the kind of transformation work and the impact that will have on workforce planning and different staffing groups and levels of need around that. We've also tried to, based on the audit recommendations, be a bit clearer about our action plan and be a bit more concise and smart about those actions, and have a clearer assessment of the risks around workforce planning too. So hopefully members will see that it has moved on significantly from the last plan. But as always, that doesn't mean there's not areas to work on, and we've outlined some of them at 4.8. So we recognise that whilst this moves us on significantly, there are some areas that still remain challenging for us to develop in terms of workforce planning, around data access, around modelling, and around some of those planning interfaces with NHS Tayside and the Council, who also have their own workforce planning requirements kind of laid upon them by government and other bodies. So trying to coordinate all of that, we continue to work really hard with them and get support from them round about that side of things as well. So it's obviously a lot of information in the report, and happy to respond to any question.
Yeah, there is a lot of information in the report, and a very important report too, because it's so important. We have so many challenges around workforce. Often talk about recruitment and retention. It's really important that we forward plan for the workforce that we need and look after the workforce that we have, so that we hold on to them. So a really comprehensive report. Any questions on this? I don't see any hands, so can this be approved, please? As in the recommendation at 2.2 to approve the workforce plan, and at 2.3 to instruct the Chief Officer to provide an update report on an annual basis. Yep, thank you.
Thanks, Chair. Takes you on to item 15, meetings of integration joint board attendances return. This is for noting.
Thank you. Dorothy.
Unusually for me, I have a question on this. It's normally just, the last thing in the meeting. The service user representative is vacant, and it has been vacant according to the table this year, since the start of this year. I'd be interested to know how long this has been vacant, what is being done to recruit to this position, And can it be added, please, to considering the importance of having service user representation on this group, can it be added to the action tracker?
Good point. Yep. Fair point. Dave.
Yeah, no, thanks, Dorothy. Again, a really important point to raise. So, so the post has been vacant since I think it was October. So, one of the priorities I've got now in terms of being permanent posts to kind of get that important position filled, and kind of looking at ways to do that, because we had a traditional route to kind of go down the public partner route from NHS through NHS to side. We're looking to see how we can consider different engagement from service users as part of that particular role. So, so we're happy for that to be added to the action tracker to kind of to make sure that's kind of front and centre and kind of held to account for the progress around that. So, thanks.
Yeah, and
Thank
we've
you.
also seen the departure, of course, of Emma Fletcher, Public Health, and also Susie. So, any update on their replacements? Dave, yeah.
Oh, so I'll let
Simon Hilton.
Yeah,
sure.
Thanks, Chair. Yeah, so I'm here representing the Directorate of Public Health today. I'm Associate Director of Public Health. We don't actually have a director in post at the moment. Myself and a colleague who are both Associate Directors are basically trying to cover the role between us until we can recruit somebody. So we're kind of just trying to juggle things between us, but we'll try to continue to represent the Directorate at this group.
Thanks very much for that, and it's good to have representation from Public Health at such a senior level. So I appreciate that very much, Dorothy.
I just wanted to say public health is really important, and the last report that we had from Emma Fletcher, I think it was 2024, excellent report, and I always kept it on my desk as a reference point for IJB meetings. And I wonder, I imagine there was a 2025 report, Public Health Annual Report for 2025, and when will that come to the IJB?
Simon, would you like to come back in?
Yes, so there has been a Director of Public Health Annual Report. I'm trying to think exactly when it's been out for a few months now. I'm trying to remember exactly when it came out. I'm surprised it hasn't been already, actually, to be completely honest, but I can check that. I can check when the release date was, and I can certainly share it and come to this group and talk about the report if that would be helpful in future, or one of us can.
Yeah, much appreciated. We'd get that sorted, that would be good. Dave, did you want to come back in? Yeah.
Yeah, no, just on the point of attendance, and I think maybe, Will, if you could maybe record Simon's attendance and of Director of Public Health at the meeting, and obviously Simon can pick up in future meetings in terms of if it's yourself or your colleague that's going to join in the interim as well. And just to say in terms of Susie Brown, kind of moving on. The April meeting was our last meeting. So there are arrangements, or there are kind of agreements around kind of filling that post that I understand are underway from an NHS side perspective. So hopefully we'll have somebody in post soon as well.
Okay, good to hear. Thank you. I think, was that our final item? Oh yeah, date of next meeting's the next. Oh no, sorry. Well, I'll go. Just leave it to you because, yeah. David's hands up though.
Yeah, sorry, Ken, I was just trying to butt in quickly before we close the meeting, and looked at I've got development sessions noted down there, the date. It's just it's kind of a plea, and I've asked this across various committees, not just IJB, but there's a number in today's agenda of annual reports and obviously updates into the budget reports and end of financial year. I for one, for meetings for this week, have had almost 800 pages to try and get through for the meetings, and I've asked this before on NHS side with the board, which I'm on as well, if documents could be released to us ahead of, rather than just waiting till the week before the actual committee. If documents that are going to be coming to that committee are ready, can we get them out to members beforehand? Because when it comes to there'll be at this time of every month where a lot of committees are all pulled together in readiness, and for NHS Tayside's board, for example, and there's a heck of a lot of reading in that. And if you're going to do justice to it, as we should do for all these committees, it would be really helpful, I think, to the members if once they're ready, they're circulated ahead of the meeting. They're going to be considered at the meeting, but if they're ready a week or 2 weeks or 3 weeks or whatever before the meeting, it'd be helpful if they're out, because we're going to be able to actually get a chance to read them rather than flash scan a lot of these things as we have to do. So it's a general plea, also to Dave in his new position, but this is only from the IJB's point of view, but I'm bringing this up at all the committees that I am on through at the NHS as well. And there seems to be a real reticence to do this because it's always been done this way. And I just don't see any practicality in that whatsoever. But I say, if we can do it, we'll do these meetings far more justice, far more questioning, far more opportunity for comments if we're given more time to read the papers. So I just make that plea and see if we can actually adopt that. I think everybody would benefit from it.
So maybe an annual report which comes out in May, but we're not going to have on the agenda to leave in August, could go out as soon as possible. If we get annual reports out as soon as possible, that kind of thing, would that help? Because certainly today's meetings, there's one page for every day of the year, and of course you've got NHS Tayside as well. Yeah, there's a lot. There's a lot of reports here today that are annual reports, and I can't believe they all just are ready a week before the meeting. Clearly they're not, and I'm not. I mean don't mean that to be accusatory at all. I just make the point that we know they're going to, if we know that they're on a work plan to be on the agendas on certain times of the year, but if they're out and available before that, why wait till a week before the meeting to actually attach them onto an agenda? They can actually be issued in advance and then referred in the agenda to as circulated on the 18th of June or whatever like that, but it still gives us a chance to read them and then discuss them at this meeting. There just seems to be this reticence to actually wait to not to do that and wait till the week before and get all the papers out in 1 week. It's just not practical to actually for members to actually deal with them all. I think our new chief officer would like to comment on this.
Yeah, no, thanks. And I do understand that, David, because I've been in the same position in terms of having NHS committee papers to read at the same time as council committees, etc. As well. So as a challenge, I think let's take that away and kind of have that and reflect how we might want to try and do some of those differently. We do actually kind of try and manage the agendas as well. So actually there was a whole lot more, many more reports that we'd originally planned to come to June that we've actually said because of the size of the agenda and the kind of the scale of the papers that were on the agenda today, we've kind of said, well, actually we can move things on to August where that's feasible. But sometimes there are things that are not kind of quite possible to do that. I know the annual accounts is one that's a very sort of specific, but the annual accounts are worked on all the way up to the last minute, and it has to kind of go by the end of June. So there are some things that have to be kind of presented within a particular timescales. There are some things on that we've kind of taken that we actually do an annual report on the basis that that was the first time that we did it, and we've just taken it a year after that. So if we take the category 1 responders, I think our first report was like June, whatever it was, 2022, 23, and we just come back in June because, well, that's the annual report. So we might want to look at those that can be moved and kind of shifted, and perhaps kind of do what you suggested in terms of things that are probably kind of likely to be less controversial as well, at least that you've got them and be able to kind of see them. But we also need to be mindful of other governance committees and where things can be presented and how they line up, because our business doesn't always just kind of sit with the IJB. It can be either kind of to the health board and to the local authority as well, depending on that. But I'm absolutely kind of happy to take the point away and review how we can approach this, because I do understand the pressure that it gives to members in terms of the scale of the papers.
Okay, thanks.
I think that's a good point that David makes, and those of us who are councillors know how our heart sinks when you see 4 inches of papers for a meeting. But it would be untidy, wouldn't it, It's just a word of caution. It's much tidier to get all the papers for a specific meeting together. And my worry would be that if things were coming in earlier, you know, they would get lost in the piles of paper, certainly the piles of paper that I've got on my desk, and you would read them perhaps weeks, you know, in advance of the meeting, and they wouldn't be fresh. So that's just a word of caution. But I mean, my heart sinks as well when I see a huge bunch of papers.
Yvonne put a comment in the chat, and I noticed her hand's up. She's maybe wanting to make a comment on that.
Yeah, like, as I said in the chat, that, you know, getting 20 different papers at different times actually causes more problems than it resolves. But I wonder if we can set up a Google Docs, and that would allow a bit of compromise between the, you know, the forms could be, or the papers could be uploaded as and when they are ready, but it keeps them all together as well. So it's maybe a good compromise there. I think that works quite well for our group anyway. But yeah, I mean, it's the fine line between getting everything in advance, but actually getting 20 different papers and 20 different emails.
This is a new record for the number of hands up for the last item. I'm losing count here. David. Yeah.
I understand exactly what Dorothy Siobhan have said. What I really mean by this, there's nothing wrong in when the agenda comes out the week before, having these articles still in there, but you know, it's just the fact that we release them for people to read prior to that, but they're still in the full agenda that comes out the week before. But if we know, I'm trying to make extra work for anybody, but if we know something's going to be reported in like the June meeting or the August meeting, for example, as Dave's referred to, or whenever the next one would be, but the paper becomes available, you know, or is ready, you know, substantially before a week before the meeting, get it out so we can actually have a chance to read it. It can still be in the full body of the agenda, so people don't lose sight of them all amongst all of other papers. It just, and it's particularly in the summertime, you know, I know I'd never have, I'm a councillor, but I never actually take recess. I think our job as a councillor is to be on duty all the time. But there's more time in the summertime to actually read papers. So if there's something available for the August meeting, it'd be great to get it out when I've got time to read it more in the summertime, because there's less on. But you get my point. That's all. Thanks.
Yeah, sure. I think particularly when we're issuing something in digital format rather than having to print out hundreds of pages of paper,
correct, yeah.
we could put it well in advance, but also include it in you know, that week before the meeting as we normally do. Yeah,
that's my point exactly.
Yeah, interested to hear what Roger Many has to say. Roger, your hands up.
Thanks, Councillor Lynn. Just to remind all elected members, as I'm sure you'll be aware, there are also legal obligations placed on the Integration Joint Board to make sure that the papers are made available to members of the press and the public for scrutiny purposes, and will clearly also require to bear that in mind in any arrangements we may make going forward.
Yeah, fair enough. Point taken. If it's an annual report though, which just comes out well in advance of the meeting, like a couple of months, and it's in the public domain, I guess there wouldn't be an issue there. But anything else, yeah, I take your point, Roger. Any other comments on that? No. And the next item is.
Yeah, thanks very much, Chair. With the item 16 IJB development sessions having been noted, the next item is item 17, date of next meeting, which is Wednesday, 20th of August at 10 AM.
Okay, thanks everyone for your attendance today. Hope to see you on the 20th, and have a nice summer. Hope the weather's good. Bye.
Thanks, Ken. Bye-bye now.
Thank you. Bye.